Hi all, happy wishes to all. Today I am going to deal with a topic like poliomyelitis. Poliomyelitis, the word which have been derivated or originated from the Greek word polio and myelo and itis. Polio which means gray, and the myelo which means spinal cord, and the itis which means inflammation. That is nothing but poliomyelitis. Poliomyelitis, the main symptom of poliomyelitis is paralysis. The mainly the children are going to be paralyzed. In that, 30% of the children who got full recovery from the paralysis, then the 30% which have been having mild paralysis, and the 30% which having moderate paralysis, and the remaining 10% which have been died. Now I am going to see what is poliomyelitis. Poliomyelitis is mainly the infectious disease. Then remember in your mind, infectious diseases in the sense any of the antigen which should be entered into your body. Here, which antigen is going to be entered into your body in the sense that is poliovirus. Poliovirus having 3 serotypes that are nothing but poliovirus serotype 1, serotype 2, serotype 3. This poliovirus also called human endemic poliovirus. Human endemic poliovirus, which is going to be affected to your gastrointestinal tract, nasopharynx, and your central nervous system. When it is going to be affected to your central nervous system, mainly it is going to be affected to your spinal cord. When it is going to be affected to your spinal cord, that time there is a chances of progressing the paralysis. I think it clear for you peoples. Then there is a chances of occurring the hyporeflexia. What do you mean by hyporeflexia in the sense? First, you have to understood what is reflex arc. Reflex arc in the sense, any of the nerve, we have two types of nerves. One is motor nerves and the spinal nerves, also called motor neurons or spinal neurons. If anyone is going to be beat me, I will get the message. I have to get the message, then only I can give the response back to the person who have been bet me. So what I want to do in the sense, what my body will do in the sense, the anyone have beat me, that time my body will give the message to the brain through the spinal nerves or the spinal neurons. That time my brain will catch the message and my brain have to send back the message back. So what my brain will do in the sense, my brain will give the feedback to that particular area. Anyone have bet me or anyone have beat me, I have to pull back my hand. So what my brain will do in the sense, my brain will give the feedback through the motor nerves or motor neurons. Then only the person can pull back their hand. So what is going to be happen in the sense, here what is going to be happen in the sense, the poliomyelitic patient, that is nothing but the person having the, I already said that the poliomyelitic patient, the person having hyporeflexia. That time what is going to be happen in the sense, my brain will give the particular area can send the message to my brain. Why? Because spinal neurons or spinal nerves is not affected. My particular area will give the message to the brain, but my brain can take the message, but my brain can't give the, my brain can give the message back, but the motor neurons or motor nerves, that is not going to be work it properly. So the motor neurons can't be functioning properly. So I can't pull back my hand. Why? Because I will not feel the pain over here where the person have been beat me. I think it clear for you peoples. That is nothing but call it as hyporeflexia. Agent factor for, now I'm going to deal with the epidemiological triad for the poliomyelitis. The epidemiological triad that have been agent, host and environment. Agent factor for the poliomyelitis, you people know what is the agent factor. Poliovirus. Poliovirus having types. I already said that poliovirus having the types. Poliovirus serotype 1, serotype 2, serotype 3 are the types of the poliovirus. That are nothing but the types of the agent like poliovirus. I think its reservoir is ourselves. Man are the reservoir for poliomyelitis. Then we have infectious materials. Infectious materials are nothing but nasopharyngeal secretions as well as our droplets. Incubation period is 7 to 10 days also called, or else 3 to 35 days. Period of communicability is till 10 days. Host factor for this poliomyelitis is host factor. Host factor is nothing but the babies who having 6 months to the baby who having 6 months to 3 years. The next one is incubation period. I already dealt. Environment. Environment is mainly rainy season. And the mode of transmission. Mode of transmission is already we said it in the infectious materials. Oropharyngeal secretions as well as the droplets. So the mode of transmission will be occurred through feco-oral route as well as through your droplets. When we are going to the treatment, there is no any specific treatment for this kind of virus. So first we have to write there is no specific treatment for the poliovirus. Then we can administer intravenous immunoglobulin. Clear? Then we can treat according to the symptoms wise in the sense according to the infection which all symptoms you people are going to be suffer. You people already know pain. Then for the pain you can administer analgesics. Pain will be there, swelling will be there, increased WBC count will be there. According to that you people can give the treatment or you people can administer the medications. I hope everyone understood my class. Thank you.